Hi, my name is Dr. Zev Wainberg from UCLA. I'm a medical oncologist here specializing in GI cancer, and I'm happy to update some recent updates from the AMPLIFY-201 study. So just as a reminder, the AMPLIFY-201 study was a vaccine study with a peptide-based vaccine examining the role, efficacy, and safety of this vaccine in a group of patients who had completed all standard therapy for pancreatic cancer and colorectal cancer. So this included primarily patients who had gone through surgery and chemotherapy and radiation, if indicated, and were treated with this vaccine. A total of 25 patients were enrolled on the study. 20 of those had pancreatic cancer and 5 had colorectal cancer. The primary endpoint of the study was actually safety, and that was reported in the first analysis. The purpose of this updated analysis was to look at long-term efficacy, meaning as defined by risk of recurrence using disease-free survival as an endpoint, and of course, overall survival as well. So ultimately, as of the data cut, the group of patients who achieved a high immune response, and keep in mind this is a vaccine that is a peptide-based vaccine trying to engage immunity against KRAS mutations. So only patients with KRAS mutations were included. However, in the group of patients who had a high immune response, which we defined internally, which represented approximately two-thirds of patients, only 4 patients had recurred amongst those 18, as opposed to uh, a higher risk of patients who recurred in those who didn't have an engaged immune response. So this was somewhat reassuring and encouraging that indeed, if you can engage an immune response, um, those patients will have uh, longer disease-free survival and overall survival than what might would expect based on historical controls. Now, the key element here was obviously number one, engaging sufficient immunity, which a large percentage of the patients did, both as measured by T cells and on some level B cells as well. We did have evidence of antigen spreading as well here, in which bystander T cells were also engaged. Um, and finally, I think what is critical is that even among the patients who recurred, all of them who had achieved a high immune response had not had not passed away from their disease. So really, what we're seeing in this group of patients is higher than expected disease-free and overall survival on some level. Keeping in mind that this is a very specific patient population, those who have not recurred yet, but were of course at very high risk of recurrence based on what we know about the disease. The study has already completed, we have already completed a second randomized phase 2 study in which a second product called the 7P vaccine, which just encompasses more KRAS variants, was given in the same group of patients in the same manner. And patients in that study were randomized 2 to 1 to receive either the vaccine or observation after their surgery and after their treatment, essentially the same inclusion criteria. So the true study, which was a randomized phase 2 study, has already been completed, and we're expecting some data to be released in 2026. So hopefully that reaffirms what we're seeing here in that we are able to extend disease-free survival and hopefully overall survival in a group of patients with a KRAS vaccine. I think if you put this in context with other vaccine strategies, and there have been some with mRNA-based and even others, we are seeing sort of a repetitive theme here is if we can engage a sufficient immunity in this group of patients, we can indeed hope for a longer disease-free survival. All of this is subject to randomized data. Like I said, some of these studies are ongoing with other vaccines. The Alicio study has completed theirs, and time will tell, but we're cautiously optimistic about the potential of this vaccine in the adjuvant setting. Thank you.